Epidemiology and Biostatistics. Today's topic is on natural history of disease and level of prevention, and I'm Dr. Muhammad Razif bin Shahril. At the end of this lecture, you should be able to understand the concept of a disease, explain the steps in pathogenesis of disease, explain the principles of disease prevention, and discuss the steps of disease prevention, and finally discuss the concept of disease prevention in relation to management care plan. So what is disease? Disease is an interruption, cessation, or disorder of body functions, systems, or organs. Disease arises from infectious agent, inherent weaknesses, lifestyle, or environmental stress. So environment is all that is external to the human host, that is physical, biological, social, and cultural. So identifying the cause of disease and the mechanism by which it spreads remains a primary focus in epidemiology. The science and study of the causes of disease and their mode of operation is referred to as etiology, sometimes spelled as Aetiology. So if you look at the iceberg here, we know very little about a disease when we diagnose a disease, whereas there are a lot of things that we don't know, which is undiagnosed or wrongly diagnosed disease, risk factors for disease, and free of risk factors. So there are three perspectives in disease, sickness, and illness. So disease is, we have learned just now, is underlying pathology, biologically defined, and the practitioner's perspective, and illness seen in terms of the theory of a disorder, while sickness is a social and cultural conceptions of this condition, cultural beliefs and reactions such as fear of rejection. This affects how the patient reacts. It also covers what is considered as a disorder suitable for medical treatment, while illness is a person's subjective experience of their symptoms and what the patient brings to the doctor. So we can see here that there is a significant difference between the meaning of illness, disease, and sickness. Disease can be transmitted uh, in terms of their communicability. So communicability is the ability of a disease to be transmitted from one person to another or to spread through the population. So we have communicable disease, which are contagious infectious disease or capable of being communicated or transmitted. Example, HIV or AIDS, cholera, influenza. And then we have another one, we call it as non-communicable disease. These are non-infectious disease and conditions. Examples are heart disease, cancer, mental illness, and metabolic syndrome. So infectious and non-infectious disease can be classified based on infectivity, which are acute or chronic. So acute is relatively severe disorder with sudden onset and short duration of symptoms, whereas chronic means less severe but of continuous duration, lasting over a long time period, if not lifetime. So this table shows the example of diseases and conditions according to selected classification. So we have up there is communicable and non-communicable, and then each of these will be divided into acute and chronic, and then there is also categorization based on infectious or non-infectious. So we can see that the communicable disease are mostly infectious and non-communicable disease are mostly non-infectious. But there are some of the non-communicable disease like tetanus, Legionnaires, and anthrax which are infectious. So there are two types of disease transmission. There is vertical or horizontal transmission. So vertical transmission is when transmission is from an individual to its offspring through sperm, placenta, milk, or vagina. And horizontal transmission is transmission of infectious agent from an infected individual to a susceptible contemporary. So, what is pathogens? Pathogens are organisms or substances such as prions, bacteria, virus, fungi, or parasites that are capable of producing diseases. The ability to get into a susceptible host and cause disease is termed invasiveness. So, the disease-evoking power of a pathogen is called virulence. So, and toxin kills pathogen by poisoning them, while antibiotics that we always prescribed by the doctors works against pathogen because of their toxicity. So there are four common stages relevant to most disease. The first one is susceptibility. Second stage is pre-symptomatic or subclinical disease. The third stage is clinical disease, and finally recovery, disability, or death. So if we can see the figure below here, it shows the preclinical or pre-pathogenesis, pathogenesis or clinical, and post-pathogenesis or post-clinical. And pre-pathogenesis or preclinical, under pre-pathogenesis and preclinical, there are two stages, which are susceptibility and subclinical disease, where in between susceptibility and subclinical disease, the exposure happens. And during stage of subclinical disease, pathologic changes happen. And at the end of the stage of subclinical disease, the onset of the symptoms, so we can start to see the symptoms. And then after some time, we go and see a doctor, where a doctor usually diagnose the disease. That is when we have entered the clinical disease stage. And after that is recovery. If it is not recovered, disability or death. So the following slides will be explaining about the stages of disease, stages of disease. The first one is susceptible, which is it precedes the disease, involve the likelihood of host has or developing ill effects from an external agent. And in stage of pre-symptomatic disease begins with exposure and subsequent pathologic changes that occur before the onset of the symptom. So this happens without the person knowing that they have the disease. This is sometimes is an incubation period or latency period. And when we enter the stage of clinical disease, this is where we start to see the sign and symptoms. And finally, we have recovery and disability or death. It reflects the expected prognosis of a disease. So this is another figure to show in detail in terms of time between the stages of the disease. So we have major categories of disease, several major categories of disease. The first one is congenital or hereditary diseases, which are familiar tendencies towards certain inborn abnormalities. So this is due to injury to the embryo or fetus by environmental factors. Example of congenital or hereditary disease are Down syndrome, hemophilia, heart disease at an early stage. And then we have another category of disease, which are allergies and inflammation. These are body reaction to an invasion of an injury by a foreign subject or substance. And then we have the third type of category is cancer, where it's categorized by abnormal growth of cell that form a variety of tumor, both benign and malignant. Next, we have degenerative diseases, which is deterioration of body symptoms, tissue, and functions. And this is often associated with the aging process. So somehow a human will undergo a degenerative disease due to old age. And we have metabolic disease, which cause the dysfunction, poor function or malfunction of certain organs or physiological process within the body, leading to disease states. Examples are cells may no longer utilize glucose normally, causing diabetes. So the following are the common modes of entry into the body of infectious disease agents. First one is respiratory, oral, reproductive, intravenous, urinary, skin, gastrointestinal, conjunctival, or transplacental. So animals can be the host, vector, or source of of certain infections and disease. A zoonosis, or in plural, zoonoses, is an infectious organism in vertebrate animals, example, rabies or anthrax, that can be transmitted to humans through direct contact, a fomite, or a vector. The word comes from the Greek word zoon, which is animal, and nosis means ear. So these are the common zoonotic diseases. So you can see that dengue fever, leprosy, Lyme disease, and then you have anthrax, you have cat scratch fever, you have yellow fever, tetanus, and so on. So let's move to prevention of disease. So disease prevention includes measures not only to prevent the occurrence of diseases, such as risk factor reduction, but also to arrest its progress and reduce its consequences once established. So this slide shows the levels of disease prevention. So we have four levels of disease prevention. There is primordial disease prevention, primary disease prevention, secondary disease prevention, and finally tertiary disease prevention. Primordial disease prevention is a prevention of emergence of risk factors in population in which they have not yet appeared. It beginning with the change in social and environmental condition in which these factors are observed to develop. Primordial prevention is done via individual and mass health education, and it is a relatively new concept and is receiving special attention in the prevention of chronic diseases. For example, many adult health problems, example obesity, hypertension, have their early origins in childhood because this is the time when lifestyles are formed. So access to energy-dense diet coupled with typically sedentary urban lifestyle creates a trend towards obesity and chronic disease. Example of primordial preventions are the first one is national policies and programs on nutrition involving the agricultural sector, the food industry, and the food import-export sector. Second example is a comprehensive policies to discourage smoking, and we can also conduct programs to promote regular physical activity. So coming to primary disease prevention, in primary disease prevention, there are two steps. So step one is health education or awareness. So health education and awareness can be conducted by giving pamphlets, posters, health talks, and quizzes. In health education, we also encourage intersectoral collaboration, which involves the community, NGO, government, and politicians. We can conduct health activities like health campaign, exercise, and mass brisk walking. And we can also enforce of specific legislation, example like Tobacco Act and Drug Abuser Act. So coming to step two, there which is specific protection. So examples of specific protections are immunization for children, pregnant mother, and high risk group, wearing helmet for motorcyclists or using car seat belt, wearing proper industrial dress, safety mask, gloves, earplug, uh, perform personal cleanliness, good nutrition, ensure clean water supply, proper sanitation and disposal of waste product, proper housing, school area, or iodine salt to prevent iodine deficiency in certain areas, example in Sabah. So in primary prevention, we have two types of strategy. There is population strategy and also high risk individual strategy. And both strategies has their advantages and disadvantages. So this table shows the advantages and disadvantages of strategies for primary prevention. So for population strategy, the advantages are radical, large potential for whole population, and it is behaviorally appropriate, while the disadvantages are small benefit to individuals because it is a population strategy. There is poor motivation of subject because it is not focused on the individual itself. There is poor motivation of physician because physician treats individually, and the benefit to risk ratio might be low. So coming to high risk individual strategy, the advantages are it is appropriate to individuals because high risk individual strategy focus directly to a high risk individual. So there is high subject motivation, physician motivation, and it is also favorable to benefit to risk ratio. The disadvantages of high-risk individual strategies are it's difficulties in identifying high-risk individuals. So we must identify first who are the high risk, and it's very difficult to identify unless we have a proper screening tool. It is the effect is also temporary, and the effect is limited, and behaviorally it is behaviorally inappropriate. Moving on to secondary disease prevention, we come to step 3, which is early diagnosis and treatment. So during diagnosis, we conduct active case detection or we conduct a passive case detection. So active case detection is when we search for the patients, whereas passive case detection is when the patient comes to the clinic. We also have screening of specific target group or risk group, proper history taking, thorough physical examination, and appropriate investigation. And during treatment, we have a specific case as a care plan, and we emphasize on patients' compliance, whether they follow our advice or taking the medication and so on. And also, we require family and community support. And here comes the role of politician to encourage proper treatment and for budgeting and so on. And we must have appropriate policy. Still in secondary disease prevention, there is step 4, which is disability limitation. So in disability limitation, we limit the complication of disease process, and we also look at the availability of facilities and equipment, which is the ICU, intensive care unit, high dependency ward. Uh, we also look at whether there is specialization in terms of neurology, number of neurologists, cardiologists, and availability to carry out detailed investigation with proper tools, availability of high potency drugs or management, and also patient compliance, family support, and budget. Moving on to tertiary disease prevention, step 5 is rehabilitation in tertiary disease prevention. So during rehabilitation, we target the physical, mental, social, and spiritual rehabilitation. So there are several services provided in rehabilitation, which is physiotherapy, occupational therapy, speech therapy, and prosthetic plans. We also conduct counseling to individual and family. We provide there is job adjustment where the company plays a role in this. Social welfare, social support group, and patients comes for follow up. So if we relate the history of disease and also the preventions, so we can correlate when is the preclinical, clinical and post-clinical history of disease, and also when does the prevention happens, the primary prevention, secondary prevention, and tertiary prevention. And for each types of prevention, what is the steps of prevention? So this figure summarizes it all. So this is another flow chart where it shows the classification of prevention strategies. So we have the level of prevention on the top and the target population on the second row. So for primordial prevention, the target of population is general population. During primary prevention, the target of population is those who are susceptible to the disease. And during secondary prevention, those who are asymptomatic, which does not show any significant symptoms yet. And during tertiary prevention, the target population is those with symptoms. And the goals during primordial preventive strategy is to reduce the risk of getting a disease. And during primary prevention, it is to reduce the disease incidence. And during secondary prevention, the goal is to reduce prevalence or the consequence of the disease. And during tertiary prevention, the goal is to reduce complications or disability. And the underlying clinical cause of disease can be seen during secondary prevention strategies, where we first detect the lesion, and during the tertiary prevention strategies, we first see the symptom, and after that is death if the disease is fatal. So now we will explore the perception of diseases or illness. So this is the last section of this lecture. So how one perceives illness or disease will determine their opinion, attitude, and practice towards disease prevention. Different levels of their perception are based on the patient himself, his family, his friends, his neighbors, or healthcare workers. And also it depends on the level of knowledge, the culture, the religion, the attitude, previous experience with the disease or other experience, and influences from others. So why is disease perception important? In relation to management care plan, disease perception will determine the incidence of disease and also the compliance of the management, whether they want to take up the medication, whether they would want to come to follow up for the next visit, and so on. And also it will determine the preventive measures taken by certain group of population. So we know that there are some people who refuse modern medication, some people who don't want their kids to be immunized, vaccinated, and so on. So this disease prevention perception will improve our management care plan. So prevention is always better than cure. That is why disease perception is very important. So this role should be carried out by everybody for prevention. It's by the individual itself, the health staffs, the policymakers, and also the NGOs. So, to recap, in this lecture, we have learned of the concept of disease, the steps in pathogenesis of disease, the principle of disease prevention, the steps or levels of disease prevention, and finally, the concept of disease prevention in relation with management care plan. So, thank you. See you again in the next lecture.